Hi, I am Dr. Jayaprasad, trauma and orthopedic surgeon practicing in Chennai. I am a visiting consultant to Apollo Hospital's OMR. Today, I just wanted to share a few thoughts on osteoarthritis. After this pandemic, most of the old cases, or in fact, the osteoarthritis cases, have started coming more. Probably due to few factors which we'll discuss now. Okay, let me tell you what osteoarthritis is. Osteoarthritis is wearing out of bones, like wearing out of joints. Usually the weight-bearing joints. Usually it is the knee joint, the hip joint, sometimes the ankle joint, and of course the neck or the cervical spine and the lumbar spine. All these can go in for erosions. These are all weight-bearing joints. Of course, due to some disease process like rheumatoid also, joints can get eroded. Usually if you see in this joint, this is the knee joint, your right knee joint. Okay, so what you see as blue color inside is your cartilage. And the cushioning material here is again something called as the meniscus like. So the knee joint takes in a lot of load, and this is your patella or your kneecap. So even this is covered by cartilage, just like this, and this articulates onto your knee joint. When you fold and get up, it helps you to get up faster, right? So when the bone becomes weak in the sense when the bone becomes osteoporotic, usually for ladies in their postmenopausal age or even for males in their old age, after 50 years, 60 years and so forth, the physiology of the bone changes, right? So all the joints where the bone is more of a cancellous nature. So what happens, the bone starts collapsing one over the other, and there's a lot of pain onto the joint. For example, here the knee joint, there's a lot of pain onto the knee joint, right? The same thing can happen to your hip joint also. So both these joints are the most common joints which get worn out faster during osteoarthritis and which are mostly replaced, like in the terminal stages. Okay, fine. Now, in the initial stages, you can take medications, little physiotherapy, exercise, lifestyle modifications, in which you reduce your weight. If you're a smoker, stop smoking, drinking, and do good exercise. Exercise in the sense to keep your joints supple, getting exposed to sunlight, and your diet. Your diet must contain enough vitamin D3 and calcium for the bone to again rejuvenate. Exercise, you need to exercise the muscles around your thigh. For example, if it is a knee joint involved, you need to improve your thigh muscles, hip muscles, and also your calf muscles, so that the progression of the osteoarthritis can be reduced. One. So in terminal cases, when there is lots of pain and all that, no drugs or other things can alleviate their pain. There will be deformity of their joints, like the legs may become bow-legged or knock knees and things like that. The joint may go in for a fusion in the final terminal stages, which are very painful. So the patient's productivity is spoiled. So in such cases, we do a surgery to replace the joint, called as total knee joint replacement. See, the worn out joints are taken away and then replaced by a prosthesis. This is one of the most successful surgeries done these days by orthopedic surgeons, and be able to walk the very next day. So some people need to change both knee joints one after the other, or sometimes at a single sitting we do change both knee joints.